It's a health condition that affects our thinking. It affects our emotions, our thinking, which is cognitive, and also our psychological. And it can be a combination of the three. So it is anything that will cause those ones to be imbalanced. Because the most common one are those, we call them mood disorders, which now we can classify. Like depression is the most common. Even hear people saying in the office, I'm depressed, you know? Even hear small people saying I'm depressed, but not really knowing what they are talking about, yeah? So depression basically is a mood disorder, which now starts, like if you have stresses, yeah? Maybe, let me use an example of a marriage setup, yeah? If you have stresses in your marriage and you're not dealing with them, or if you have a strained relationship, let's say parent-child, yeah? Or even in the workplace, with your supervisor or your colleagues, if you don't address the issue, it starts growing, yeah? Like now it will start as a mild depression. No, not mild, yeah, mild, yeah? Then it moves to if not addressed, it becomes moderate. So by the time it gets to severe, that is when you say you have depression. Now it has graduated from stress to depression, which is now becomes a disease, which is a mental illness. And then the other one is bipolar, which is also very common, very, very common in Kenya right now. And it basically makes an individual have highs and lows, yeah? So when you're having a depressed mood, yeah, you feel hopeless, you know, you feel insignificant, you feel worthless. That is why we say, that is why now they become prone to suicide. They start having suicidal thoughts. But when they're having their highs, you'll hear somebody suffering from bipolar telling you, I'm the president of this country, you know, I own this. They have a high. So that's a mood disorder, mental illness, yeah? Then we come down to psychotic. So psychotic is that which affects the mind. Like now, the most common is schizophrenia, whereby you get hallucinations, yeah? You get hallucinations, you get delusions. Those are the first symptoms, yeah? You start feeling, you're seeing things that people are not seeing, yeah? So that is psychotic, yeah, affecting the mind. And then we have anxiety disorders, also very, very common, yeah? And this one basically are caused by fear, by worry, you know? You just feel, you get panic attacks. That's also a sort of an anxiety disorder. Then when you come down from anxiety disorders, we have the traumatic like now post-traumatic stress disorder, which basically is a disorder, a mental illness that is caused by, you go through an experience in life that really traumatizes you. For example, rape is a very traumatic experience. We saw post-elections, yeah? You know, those experiences in life, yeah? And even those guys, I think it's a Changwan where the lorry, the truck for fuel, the tanker rolled, and then now that is traumatizing because you see your person getting burnt or even you yourself. So all those are traumatic disorders, yeah? And they're mental illnesses, yeah? So those are the most common, but we still have others. Like the classification according to the DSM, which is basically the Bible for psychiatrists and psychologists. It has so many classifications of mental illnesses. Okay. We also have eating disorder.
Yeah, so there's a lot.
I feel I should talk about that. Yeah. It's a mental disorder because it affects mostly the adolescents. Yeah. So when somebody has anorexia, as she has mentioned, you feel you're overweight, but in real sense you're underweight. So you even purge, you try and vomit, yeah, to get it out. I've been preaching this gospel and I'm happy to be here to continue preaching that we need to be our brother's keepers. And in the family setup, in the work environment, in the community, in the estates, in your neighborhood, it's important we are too busy, number one. We are too busy, I included, I'm not like removing myself, we are too busy to observe what is happening in the other person's life, yeah? So it's important to pause and you ask yourself, what is happening in Emma's life? What is happening in Trisha? Just checking, yeah? But then there are those now, the medically confirmed symptoms, yeah? Like if I look at Emma, she's normally very cheerful. She's normally an outgoing person. Then all of a sudden, she's lost interest in activities that she's been interested in. Yeah. So when you see somebody changing in that behavior, that's a red flag. Then you see somebody has lost weight. Yeah, over a period of time, they lose weight, yeah? And it is because their sleep patterns are affected. When you have a mental illness, your sleep pattern is affected. Either you sleep too much or you have insomnia, which is lack of sleep, yeah? And then the other symptom is that you become so moody. You snap. You become irritable. Somebody gets angry. And then there's the aspect of isolation. You just want to be alone, especially with depression. You want to lock yourself. So if you see somebody is not talking to people maybe in an office setup, or even in your house, if you're a teenager, of course there's that teenager thing of them wanting to be in their rooms, but you can tell the difference. So watch out within the family, your spouse, whoever, are they isolating themselves, yeah? And then there's also the element of having hopelessness. You just hear somebody saying, okay, me nimechoka na maisha. Me, I think I'm done with life. That's also a red flag, yeah? Mm-hmm. And then also there's the element of having suicidal thoughts. Actually, but now those are the extremes, yeah? So when somebody has suicidal thoughts, in our African culture, we normally say, you don't take it seriously because, as you said, it has not been taken seriously. So if somebody tells you, by the way, I'm thinking of committing suicide, please ask questions. Is there something bothering you? Can I refer you to somebody to talk to if you feel you are not free with me? So when you watch out on those signs and symptoms, yeah, and also it should be for more than 2 weeks, because sometimes you can just be moody one of those days, yeah. But now it's more than 2 weeks, and you're seeing this behavior is not. There's something wrong with this person. Now you take the next course of action. I think, as I mentioned earlier, the facilities in Kenya, most of them are private, but they help a lot. So when you notice, the first thing is you can start a conversation, yeah, so that you know where this person is, yeah. So when you start a conversation and they're able to open up, then you can say, I think you need to seek help. Maybe you need to see a counselor. Maybe you need to see, somebody, a specialist.
Thank you so much, Emma. That was very informative. We have learned a lot about mental illness. Mm-hmm. As we wind up our conversation today about mental illness, we believe that we have educated you on mental illness, that you have a better understanding of it and how to support loved ones who could be suffering from it. We ask you to wait on our future episodes where we will be talking about depression and how it manifests in men and women.
We would also love to thank NTMC Dai, who are the host of the venue where we've been able to shoot this show. A big thank you to you. But until next time, it is a goodbye for us. Be sure to subscribe to our YouTube channel at Your Health Kenya, and also on our social media pages on Instagram, Twitter, and Facebook. But until then, it is a goodbye from us.